Good morning. Perfect. Good morning. For those who don't know me, I am Allison Kritzinger. I'm our Director of Public Affairs here at the Department of Children, Youth, and Families. It's great to see so many new and familiar names coming through on the chat screen or on the participant list. We are in a webinar format today, a presentation format. So there is a Q&A box at the bottom of your screen where you can type in questions. Your panelists, your hosts and panelists will see those, and we will respond to those either live or in writing, depending on the question. We may hold some of them and do them at the end, but please feel free to use that Q&A box to type in your questions as we're going through the presentation. I'm joined by our Chief Financial Officer, Renee Newkirk, today, and we are going to, in 57 minutes, try to walk through a number of decision packages and agency request legislation that DCYF has submitted to the governor's office in as much detail as humanly possible, and explain to you why we are asking for well over $1.5 billion new dollars for our agency, for our providers, and for the clients we serve. So really honored to be able to be here today and give this presentation. So with that, we can go ahead and go to the next slide. I want to ground us in the timeline and the roles and sort of where we're at in the process. For folks who have joined before, definitely a familiar slide. For new folks, the intention of this slide is really designed to articulate the timeline and the roles that each of these entities play. State agencies, that's us, DCYF is one of those, as well as the governor's office and OFM, largely our authorizing environment, if you will, and then the green bar being the state legislature, those senators and state representatives who come to town every year and make decisions and choices about policy and investments for the state of Washington. So this year we're in a biennial budget setting session. DCYF has successfully submitted our requests to the governor's office in that September timeline. Now the governor's office and OFM will work to build the governor's budget, which we anticipate release of in mid to late December. And then that really starts the process with the conversation and process that we'll have with the legislature around setting the biennial budget, passing bills, changing policy, changing law, etc. So just want to ground us in the timeline and where we're at in the process. Go ahead and go to the next slide. So what does this mean for DCYF? Each year we set priorities, we set policy requests and funding requests and submit them to the governor's office. We ground ourselves in some guiding principles as we do that. I also want to recognize that there is infinitely more opportunity and need than we submit in any given year. We are sometimes limited by financial realities, by sort of how far along an idea has been developed, etc. But these guiding principles are really intended to be sort of our foundation as we move through our requesting process. So at the core of our work, at the core of our strategic plan and the core of our decision-making and guiding principles is really prioritizing programs and services that reduce racial and ethnic disparities, and focus on eliminating racism, prioritizing equity in our decision-making. That's really, really important across this agency. You see that reflected in our strategic plan, and you'll see that articulated through many of the asks that Renee and I will talk about today. We also have a responsibility to focus on the core, prioritize resources that focus on our core responsibilities, our core mission, our core vision, our strategic priorities, the clients, the providers that we serve. For the state of Washington, that's broad. DCYF has a prevention piece of our work, as well as intervention, both in child welfare, and then deepen penetration in our JR system that we have responsibility for, as well as a high quality integrated early learning system. So you'll see a number of requests that focus in on varying areas of what I like to think of as our continuum of work, care, supports, and services. In addition, go back to the last slide, sorry. In addition, and related to that is one of our goals is to prevent system penetration and deeper penetration into systems for children, youth, and families. It's one of the main reasons we are created. So we are looking at prioritization and focusing in on those investments that are going to help prevent penetration, but also recognizing that when children and families do come into our systems of care, focusing on how are we supporting system, successful transitions, reentry, exits from care, reunification, successful transitions to sort of the next phase. And so you see that throughout our work and asks as well. We're also looking at programs that have demonstrated promising practice or evidence bases that we know are going to achieve the outcomes for our supports and services. And I like to think this is we know this is a biennial setting session, a biennial budget setting session. This is the time to be bold, innovative, and be thinking big. Supplemental years, we're a little more constrained. This is a biennial setting session. You'll see that reflected. The totality of our asks, the components of our asks, the amount of our asks are bold and they are big. And so you'll see that throughout. And as I noted, not everything makes the list. There are things that you'll see absent that you may have questions about. Happy to answer those as we go. Not everything makes the list. There's a variety of criteria and decision-making points along the way that sort of lead us here. We want to go to our next slide, high-level clip of our strategic priorities available on our website, probably very familiar to many of you. Go ahead and move to our next slide. So we have the timelines, the sort of external timelines that guide us gearing up for the legislative session. We also have internal processes, decision points, and timelines that guide our work. And so you can see from this slide that our preparation for this set of asks that we submitted 48-ish hours ago began almost a year ago. We kicked this process off in November, December of last year inside DCYF, and then really moved through a series of iteration, of feedback, of problem statement identification, solution identification, both internally with our teams, our staff, our leadership team, as well as externally with stakeholders. And we've been doing that sort of in an iterative process, really since December, January of last year, continuing all the way up until just a few days ago, frankly, as some decisions were getting made before we hit that final submit button. So you can see this is sort of our internal process. Our process will look similar for years moving forward. It's a lot of work for state agencies to get to this place. And now I was in a meeting yesterday and said, we just crossed the finish line. And someone said, actually, we just hit the starting line. And so now the work begins. It's a continuous process for Renee and I and our teams who, I just want to give a huge shout out to our teams who have done incredible work through this process. The final products you see, the decision packages, our PowerPoints, our one-pagers, the work that now Renee and I get the honor to carry forward for this agency is done by a tremendous amount of people who work alongside us that have done tremendous work throughout this entire process while simultaneously managing session last year and implementing everything that passed. So no rest for the weary in state agency land over here. So with that, I think we can go to the next slide, talk a little bit about realities and budget realities. I'll turn it over to my colleague Renee to introduce herself and talk through some of the realities that we're heading into as we head into sort of this build and session.
Thank you, Allison. Hi, I'm Renee Newkirk. I'm the Chief Financial Officer for Department of Children, Youth, and Families. As Allison stated, it is such an honor to be here with you this morning. This session is going to look much different. Previous sessions may have felt like there's just been excess revenue, which there has been. We've had access to federal stimulus grant funding, which that funding is now starting to end. Some of it's already ended. The budget revenue forecast just came out this week, which shows a decline heading into the 23-25 biennium of $495 million. That dollar amount feels very large in the context of the state. It's a decline of 0.7%, so it's less than 1%. But I think that just acknowledges the projection where we're heading into revenue starting to flatten and even starting to slightly decrease heading into next biennium. So that is the reality of where we're at. As we have put forward our decision packages, our budget submittal, which as Allison noted for the biennium is over $1 billion, which is significant. I don't think that we're alone in that, in the state agency submitting a very significant request. So the governor's preparing for his proposed budget. He's going to have to make some very difficult decisions. There's going to be some prioritization and such. And so there's really more limited revenue, I would say, than what there has been previous years. And then also the legislature is going to have to make those same decisions based on the more limited revenue that we're starting to experience. So just wanted to ground us in that reality, that it is, we're starting to see more of a tough economic cycle, I would say, just starting very, very beginning stages of that, starting to see that. So this session is going to look much different, I will say that. Okay, we can go ahead and go to the next slide now that we're grounded. We have listed on this slide 21 decision packages that we will review with you in this webinar today. Of which there are 2 agency request legislation that we will cover as well. So I'm not going to go through this list. This is really just highlighting and previewing what we're going to be discussing with you today. So we can go ahead and go to the next slide, and I will start diving in here. So our first decision package is pertaining to prevention. So this is very high level, themed, multiple components contained within this request. The goal of this request is to reduce our foster care placements by investing in substance use disorder treatment. Our request includes several components pertaining to substance use disorder treatment, how we're planning to address that. I'll just name a couple, which is to connect pregnant people to voluntary services before birth, and then connecting substance exposed infants and their families to services at the time of birth. That's just to name a few. We have several different substance use treatment strategies within this request. We're also requesting to reduce the child maltreatment. We have an existing program, Strengthening Families Locally, where we're requesting funding to continue and expand this program, which is really targeting the communities where we're seeing most significant child maltreatment. And then also we're requesting to expand our home visiting program. And we also have a placeholder request for family reconciliation services, of which we're currently working on a report to submit to the governor and the legislature of recommendations of how we'd like to redesign this current program so that it can be even more successful. So our request will be based on recommendations that will be forthcoming in this report. So again, pretty robust request. In summary, requesting substance use disorder treatment, addressing child maltreatment, home visiting and expansion of home visiting, and family reconciliation services. So with that, we can go ahead and go to the next slide. I should have also noted, you'll notice that on the left-hand side, this is noted as a capital budget request. What we're reviewing with you today is a couple capital requests. So our budget is structured in, we have our operating budget, budget necessary to continue the operations of DCYF, and then also capital budget requests, which is really the construction, planning of construction, etc. So this is in the category of our capital budget request. With this request, we're requesting funding for the construction of a Rising Strong residential treatment program, which currently exists on the east side. We're requesting this program for the west side. So in order to implement this program, we need the construction site to have this center. And what this program does is the goal is to keep families together while receiving treatment. So it's a holistic family approach. So parents in this program will receive treatments such as detox, SUD treatments, recovery coaching, parent skills, and then children in the program who are residing within the center with their parents will receive quality childcare, educational support, mental health screening and assessment. So it is really a treatment of holistically the entire family, serving the family together We're seeing great success on the east side, so want to bring this to the west side. So we can go ahead and go to the next slide. Combined in-home and transition services. Combined in-home, we saw during the last session, during our last supplemental budget, providers received a rate increase, which was great, but that's just really the first step of what needs to be done here. We still have areas in the state where clients don't have access to these services. So we'd like to expand and ensure that we have that equity and all clients have the ability and access to these services. So what we're requesting is we're requesting funding for capacity building grants. So really doing assessment of what are the communities where we're lacking these services, and then build those services up, get provider capacity. So requesting capacity building grants. This is not unique to DCYF. We also have this in our home visiting program, have seen success there. So now bringing this over to combined in-home services as well, requesting it here. And then with expanded providers and capacity, then we'll need additional funding to begin growing our services. So requesting for that as well. So capacity building grant and additional funding for services once we've seen the success of those capacity building grants. And then another component of this DP is our transition services. So a component of the transition services is our independent living expansion. We're developing a new approach to our transition planning for young people that are exiting care and exiting juvenile rehabilitation. We're redesigning our independent living contract, of which we have a report also due to the governor and legislature. And this request will be based on those recommendations included in the report. We're also requesting an expansion of our LifeSet program. This is focused on 17 to 22-year-olds involved in foster care, involved in juvenile justice and mental health systems, and transitioning to adulthood. We currently have this in King County, Yakima, Tri-Cities, and we'd like to expand this to 8 additional communities. So that's what's also included here in this request. So we can go ahead and go to the next slide. Caregiver placement supports. Also, you'll notice the theme here, same, safely reduce the number of children in out-of-home care, and to also create equity in the financial supports for caregivers. Kids that are placed with relatives, we want to ensure that they receive the same level of support. So creating equity across all of our caregivers is one of the goals here with this request. We currently have a 4-level maintenance payment rate structure. And this is requesting to replace that 4-level maintenance payment rate structure with a 7-level rate structure system. At DSHS RDA, they performed an analysis several years ago pertaining to this. And so we're taking that analysis, taking that study, and we'd like to now implement it on how we can address more equity in our system and address that caregivers really receive the supports that are needed. So replacing with a 7-level system. In addition to the 7-level system, the continuation of the theme, ensuring that we have equity across all caregivers, we then like to ensure that all caregivers, regardless of licensure status, receive what we're calling standard supports. So in addition to where you fall within the 7-level system, ensuring that you get access to standard supports, which include items such as education advocacy, childcare coordination, respite coordination. So your maintenance payment in addition to a standard support. Then if you are on the deeper end of the 7-level system, in addition to standard supports, also receiving a behavioral support. So the behavioral support would include things such as real-time parent training and coaching, behavioral support, behavioral respite planning, etc. So different levels and layers of support to really ensure that our caregivers are receiving the resources that they need to care for kids in care. So we can go ahead and go to the next slide. Family time. Our family time request has two components of it. We're requesting funding for what we're referring to as our separate billable items. These are predominantly reports that providers complete, such as when a visit is missed or there's a no-show. Providers prepare a report and submit that, and we would like to be able to reimburse them, which we currently are, which was effective November of last year, which the agency is covering with our own funding. This was a request we had submitted last year. It was not funded. So we're scaling back this year what the agency is able to sort of fund on our own. But I will say that that is a scaled approach. And if we do not receive funding this session, we're not going to be able to continue covering this. So after this year, if we don't receive funding, we're not going to be able to continue reimbursing for this. So that is included here. And then also it's the expansion of the network administrator model. This is something that we have implemented on the east side. And when this was implemented on the east side, it was a phased in approach to where first family time was under the network administrator, and then several years later implemented combined in-home services. So this is that similar phased in approach to where this next biennium, we're just requesting the network administrator model to transition statewide just only for family time. And we're also requesting a 3-month transition period. So from July through September of next year, requesting the period of transition for providers to hire staff, build infrastructure, and then really begin providing the family time services under the network administrator model effective October 1st. So that's what we have included in this request. So we can go ahead and go to the next slide. DS compliance. This proposal, as many of you have probably heard, pertains to us implementing reforms to eliminate the use of our hotel stays and one-night placements as required by the DS lawsuit settlement agreement. There's many components to this request as well, as each of the components in our request addresses what was included in the settlement agreement. So as you can see here on the slide, I'll just very, very high level go over each one of them. Emerging Adulthood Housing Program. This requests housing and case management supports to ensure that we have stability and prepare youth for independent living. Professional Therapeutic Foster Care. This requires DCYF to develop and implement a professional therapeutic foster care contract and licensing category. Statewide hub home model. This model currently exists today. This requires us to further develop, adapt, and expand our existing hub home model. Family group planning. This requires us to improve and revise our shared planning meeting and our family team decision-making policies and practices. Referrals and transitions. This item requires us to develop and implement new referral and transition protocols. Referrals, what we're seeing are not consistent. They're not consistently based on trauma-informed, culturally responsive, and they're not affirming for our LGBTQIA+. So really addressing that. Qualified residential treatment program. This requires us to conduct assessments for children and youth prior to placement in a qualified residential treatment program setting, and then every 90 days after for the duration of that placement. And then the settlement agreement also requires us to develop an implementation plan and to engage a monitor to ensure that we are following the implementation plan and meeting the requirements as outlined in the settlement agreement. And we're also required to conduct stakeholder engagement. So this is our very robust request for DS compliance, which we feel really addresses what's required of us in the settlement agreement. So we can go ahead and go to the next slide. Licensed kinship placements. This request is for relative placements promote stability, decreases likelihood of reabuse, institutional abuse. This focuses on placements with licensed kin are increasing. They're going to continue to increase with implementation of Keeping Families Together Act, our child-specific licenses, which we've already implemented, initial licenses, which will be implemented under the Keeping Families Together Act, the Washington Supreme Court case that regarding dependency of KW, in addition to the agreed settlement order in the DS case. And also it's the agency initiative that we'd like to see increase placements with kin, and we'd really like to see them become licensed to provide necessary resources. It's just the right thing to do for kids. So that's what this request pertains to. And I should also note here, and I should have noted it in our combined in-home ask, Allison and her team and their stakeholdering noted, and we acknowledge the need for concrete goods for kinship and concrete goods in the area of combined in-home. And we did not submit this in our decision package for the reason of, as we were closing our books for the fiscal year, we have underutilized resource in the area of concrete goods. So the agency didn't submit it because, essentially being good stewards, we don't need the funding in this area. We acknowledge that concrete goods are very much needed. And so the agency will look at what practice policy changes do we need to make to ensure that access to these very important concrete goods are actually received. So just because you don't see it in our request doesn't mean that it's not needed. We acknowledge it is needed, and we'll work on our end internally as an agency to ensure that that access to those concrete goods exists. So we'll make necessary changes there. So we can go ahead and go to the next slide. CWIS, this is our Comprehensive Child Welfare Information System. This is the federal term for the Child Welfare Case Management System, currently known as our family system. The federal government is really nationwide, not only in the child welfare space, but in the Medicaid space, in almost every area, really promoting, encouraging states to move towards a modular system. It's really fiscally responsible, makes more sense, because when changes are needed to a system, if it's applicable to a specific module, if it's a modular-based system, you can just make those updates or changes to that one particular module versus replacing the entire system. These systems are very expensive. And also, to be very transparent, we received funding for this, this current biennium that we're in now. And we as an agency decided to really slow down the implementation of this, because what we saw was other states that were implementing their CWIS system early were not successful. And these systems can be as much as $100 million. And that's just not good use of state or federal dollars, because essentially states that have tried to implement this quickly and haven't been successful, it's just a loss of funding and money and taxpayer dollars, et cetera. So in seeing this nationwide, we really needed to slow down our approach and look at the other states, learn from them. What mistakes did they make? We engaged the federal government more, had a lot more research, et cetera. So that's why we're coming back with this request for this next biennium. And what we're requesting is for a feasibility study. So this request is for a feasibility study. And then in addition to that, based on the timing of it, we acknowledge that if we are funded for a feasibility study, we'll also need to begin implementing, which is why we're requesting some FTE to begin implementing based on the feasibility study but we're only requesting to start that process. We'll come back in another supplemental to really request the funding needed based on the feasibility study, but we would like to start it once we have results from the feasibility. So that's what this request is for. So we can go ahead and go to the next slide, where we have another IT request. Our SSPS replacement, social service payment systems. This is a payment system. And again, this is one also where we had received funding last biennium. The agency also decided here that we needed to delay implementation, as we really wanted to be in alignment with our other health and human service agencies. We have what's called the HHS Coalition, where we talk about our IT systems and where there's intersection, and our health and human service agencies here within Washington, such as DSHS Healthcare Authority, Department of Health, us, etc., are really focused on integrating eligibility. And so we want to implement our SSPS replacement system, our replacement payment system, to really integrate eligibility and really focus on that effort that we've committed to with our other agency counterparts. So again, that's why we're coming back here this session, requesting for feasibility study funding here as well. So we can go ahead and go to the next slide. This is kind of a more technical request, so I'm going to try to make this very high level. CCDF, Child Care Development Fund grant audit. This is one where federal government largely has said, yes, we're in compliance with the CCDF program. However, the state auditor's office would like us to see in our grant management processes, as we're managing the grant and needing to do certain transfers and maneuvers, that we include child level detail in those transfers. We're currently not able to do so. It's a very intricate process that's going to require a resource for us. So that's simply what this request is, so that we can meet the request by SAO, and hopefully then therefore not have a continued finding if this is funded. So that's what this is. With that, I will turn it over to Allison, who will start us off with reviewing requests for JR.
Excellent. Thanks so much, Renee. Take a deep breath. So much information. I just want to call out, there's a couple questions in the chat that we'll save till the end. We'll want to get through sort of the rest of these, and then I see them and we'll address them at the end. So thanks so much. So shifting a little bit, I'm going to start with a couple of asks related to our juvenile rehabilitation space. The first one you see here is a capital ask in line with the direction that the agency has been heading around creating, supporting successful transitions, focusing on least and less restrictive environments for young people. We have a capital ask that does a couple of components. The first is the first step in feasibility work around and pre-design funding to site 2 new community facilities, one in Clark and one in Snohomish County. When we look at our data and we look at some of our master planning data, we know that we have young people coming from Clark and Snohomish counties that don't have opportunity for that step down or that community-based setting as they finish their time in our care and custody. So that is one component of this. The second component of this is beginning the process to renovate some of our facilities on our Echo Glen and our Green Hill campus to create transitional living centers. So a minimum security option that is connected to the institutional campus, so young people have the ability to sort of be in community for education, employment, other opportunities, but also have that tether to some of the institutional services like the therapeutic services, the health clinic for those who need it. Really, this is sort of adding a piece of our continuum and adding some minimum capacity on our two institution sites within existing sort of capital that already exists, capital projects. So again, fully a capital DP here, and highlight those two of those components, or capital ask, I guess, highlight those 2 components. We can go ahead and go to the next slide. For the last couple of years, DCYF has been in partnership with the Office of the Superintendent of Public Instruction and a variety of stakeholders moving through a task force and then a work group related to institutional education and improving outcomes for young people who experience education while in an institutional setting. The work group and recommendations are nearly final. And so we have submitted a decision package as a placeholder in anticipation of needs that DCYF will need to help support and facilitate education access. I want to be really clear. DCYF is not the deliverer of education in our institutional settings. That responsibility rests with school districts and the Office of Superintendent of Public Instruction. But we recognize that we have a responsibility as the provider of the care of young people to facilitate successful attainment of education and completion of education when possible. And so this ask is really about what DCYF potentially will need to continue to support a focus on improved outcomes. So more to come, submitted as a placeholder, and we'll fill in details as we see that report. Next slide. So this ask is about housing access and supports for young people across and families across our continuum of care. A couple of key elements here. We know that housing and housing stability is critical to the success of both reunification, parenting, potentially prevention, but also for young people exiting our JR system. And so a number of things included in this. I want to give a huge shout out to the partners that we've worked with to help build this DP, because a lot of this work is really going to be done in partnership with housing authorities and local community-based organizations. This ask is really about maximizing some federal investments through FUP and FYI vouchers, housing vouchers that do require ongoing case management. When a family or a youth exits or is ready to exit dependency, we want to ensure that can happen, but we also don't want to jeopardize their access to housing. And because those federal vouchers do require ongoing case management, we recognize that once the dependency is no longer necessary, a community-based organization is likely better positioned to provide that ongoing case management. So a large component of this ask is that ongoing case management work that will be contracted out to support that housing stability by maximizing those federal resources. Additionally, this will support continuation of what was a bill that passed, I believe, in 2019. Someone will correct me if I have that year wrong, but I'm pretty sure it was 2019. That will continue funding for the child welfare housing expansion, which is exactly that, to provide housing for families who are reunifying and where housing is a barrier to reunification specifically. So we'll continue that and expand that to other parts of the state. Additionally, we have an ask for regional housing capacity. So this is for staff to be engaged in community at the regional level to support housing initiatives, housing work, housing collaborations, etc. Go ahead and go to the next slide. So I'm going to shift now away from our JR population and go upstream to our early learning population. We have five decision packages, I think, related to the early learning space. The first one here, and I will note all of them are inclusive of many components. These decision packages will be posted on our website as we go. And so just know that as the day wraps up, the slides and DPs will be posted so you can see more detail on what's included. This first decision package is related to families largely accessing working connections childcare. We have a responsibility to continue to make our systems that we implement work better for all families. We have a responsibility to remove and reduce barriers that are largely inherently racist and have existed in systems for years. This is one of the core analyses that we are doing as we are submitting ideas and submitting policy and funding proposals. And that's what this package is about. This package is about reducing and removing and eliminating barriers that have existed for families to access financial support to pay for childcare, so they can work and mitigate their family needs. It does a variety of things, allows authorizations for full-time care only. We know the Part Day authorizations are challenging both for families and providers, and they don't mimic the private market. So as we think about what the private market looks like, you'll see some elements here. Additionally, removing barriers around approved activities and what qualifies for approved activities, removing the 12-month grace period barrier for families who are still working to remedy homelessness, houselessness, looking at different types of removing barriers around income that's counted to better support families in being eligible and maintaining eligibility for this financial support for childcare payments. This package also increases the child welfare early learning navigators. This was a program that was funded out of the preschool development grant that has been wildly successful in connecting child welfare involved families to early learning support in their community, childcare, but others like home visiting, early intervention services, other early learning support. And so we want to make sure we have resource for those navigators to continue. So a number of elements here, but all really focused on removing barriers and supporting families in accessing childcare. I'm going to go to the next slide. So the other side of the childcare reality is providers, and we have a responsibility and obligation to continue to support providers as well. It is true that through the pandemic, we have seen investment in the childcare provider community, both at the federal and state level, and we recognize it is simply not sufficient. The market continues to be in crisis. We are challenged by workforce issues in this space. And so this package is really about investments and barrier removal for childcare providers who are day in and day out doing incredible work and have been doing that for decades, but especially through the last couple of really challenging years. So a couple of elements I'll highlight in here. Again, we want to move to a subsidy market that looks like does look like and work like the private market. This is really about making this business model work for providers. And so the first element is a sustainable and predictable subsidy payment structure. Historically, this has been referred to as or contemplated in the vein of enrollment-based payment. And so asking for that to be the way we can pay subsidy to providers. Also adding a non-standard hours bonus. So this is, we see huge need for childcare late into the day, early into the morning, on the weekends, and there's limited availability. And so thinking about ways, this is really a bonus intended to incentivize those hours of care and access of care for non-traditional work hours. Also see expansion of grant funding, the complex needs, and the equity grants. We saw huge demand for the equity grants and the complex needs grants. And so we're asking for more resources in both of those buckets to continue and expand the grant programs that were funded as part of the Fair Start for Kids Act. We see expansion of our early ECEAP here as well. So those high quality family support wraparound infant toddler slots as well. Also looking at beginning to think about how we might do and implement contracted slots. This is specific for child welfare involved families, but looking at contracted slots and authorization to start that. In addition, we have an infant rate enhancement. Again, we see huge gaps in infant care across the state. And so looking at ways to incentivize and support providers in being able to offer infant care in ways that are more financially stable and sound and help support family affordability. And then also this package will ask for alignment around our overpayment collection fees are not currently in line with federal requirements and want to do that. And this again is about reducing barriers that currently exist. We want to go to a next slide. So this is a maintenance level decision package as part of Fair Start for Kids Act. It contemplated and directed rate increases through working connections, as well as copay adjustments and increasing family eligibility. So to comply with the law as required, we are submitting a pretty substantial ask to increase childcare subsidy rates to the 85th percentile, as well as adjust the copayment as directed by the Fair Start for Kids Act and begin to increase eligibility to that 75% SMI, which will go into effect in July of 2025. Go ahead and go to the next slide. So our next slide is about continuing preparation for ECEAP entitlement and expanding ECEAP. This slide is this decision package. Again, a number of elements. Key elements here are rate increases for the school day and working day slots. We know the rates currently don't adequately cover the need for those longer days. Asking for new slots to meet entitlement, so 6,000 slots at an 85% to 15% split between working day and school day and working day, excuse me. Also continuing conversion, so taking some of our part day slots and continuing to convert those into school day slots. We know this is what families need. They need a longer day. They need a day of preschool and care so they can work. Also asking for continued expansion of our complex needs fund specific to ECEAP providers. Again, saw huge demand as this has been rolled out the last couple of years. So looking to expand the availability of resource there for ECEAP providers. Also have a specific ask for scholarships for the ECEAP workforce. As we grow ECEAP to meet entitlement, we are going to have to grow the workforce as well. And so have some specific scholarships in this bucket. In addition, there are scholarships through the childcare side as well and maintenance level. So that resource does exist as well. And then this package includes some other pieces that are necessary around infrastructure for entitlement, ensuring that resources exist for the quality supports that are required for providers to offer, as well as how do we help and have some readiness focused activities to bring on new ECEAP providers across the state. See that in this DP. I'm gonna go ahead and go to the next slide. So we also, along the lines of the Rising Strong package that Renee talked about, we have a capital request for the Early Learning Facilities Fund. This fund is managed very well by our partners at Commerce. And so this funding would actually go to Commerce, but we prepared the decision package because we obviously have tether and connection to the network, to providers and the data. And so we are submitting this DP, again, funding to Commerce for this. Two components: continuing expansion and more funding in the Early Learning Facilities Fund grant program, as well as asking for dollars for non-expansion minor renovation grants. We saw a one-time investment with some federal subsidy dollars or federal stimulus dollars into minor renovation grants. Again, huge demand, wildly successful. We would like to see ongoing investment, additional investment in that line as well. So that's what this capital decision package includes. Go ahead and go to the next slide. Thank you. So our, I think this might be the last decision package I talk about, is our culturally relevant language access program. DCYF a number of years ago was asked to create a language access plan. We did that. We now need to implement that, and that's going to require a resource. Additionally, we have some fantastic partners who worked with us to bring on language access capacity and specialists as we were doing outreach around many of the early learning pieces. We want to expand that across the agency to ensure that all of our clients and those we are working with have access to the language, to services and to DCYF interaction in the language that best meets their family need and best meets their needs. So this has a variety of pieces around website translation, language coordinators, language access coordinators, focused on communications and language access specialists, as well as staff training across the agency. So when language access needs are identified or a family notes that, our staff are prepared to support them and know where to go to do that. So excited to see an ask related to our plan coming to fruition and life. Go to the next slide. I was right. Okay, so that wraps up our decision packages, just a few of them there. And now I'm going to talk about our two pieces of agency request legislation. The first has to do with background checks and licensing fees and schedules. So throughout the pandemic, we saw background check and licensing fees waived in childcare. That's worked, and we'd like to make that permanent. So this bill, those were both temporary changes over the last couple of years. We'd like to make those changes permanent and in fact, remove background check fees for all providers in our system, both childcare and group care staff. So that's what this bill and ask would do. In addition, it would make permanent the removal of licensing fees for childcare providers. So again, removing barriers to standing up and opening childcare and maintaining childcare across the state. In addition, this bill contemplates the timeline for the initial license for foster parents and kin placements. When 1227 comes online next year, we will be issuing initial licenses, and we want to make sure that folks who have an initial license have adequate time to move through that licensing process, either onto a child-specific license or a full foster home license, if that's what their path is. Currently in state law, that initial license is only good for 90 days. We don't want to create a cliff for families who take young people into their home who are placed in out-of-home care, especially our kin and our relative providers, who are largely the intent of that initial license as part of the Keeping Families Together Act. And so we are asking for the initial license time period to be moved from 90 days to 6 months. This would mirror the staffed residential or group care initial license period as well, with some renewal options. It's really about continuing to support those who are sort of raising their hand to be caregivers when young people do have to be placed in out-of-home care, and ensuring we don't create financial cliffs for folks who do that, who step up to do that. The final and last slide and final piece is a state-funded RGAP. So RGAP is the Relative Guardianship Assistance Program. This is financial support for young people, or for placements when a guardianship is established. Currently, the RGAP is limited to families who are 4E eligible. We are seeing less and less families achieve 4E eligibility. 4E eligibility is tethered to a federal standard, a federal economic standard, and it's rooted in a very outdated 1990s economic tether. We are seeing less and less. Renee, I love your face as I try to explain how 4E financing works. I'm good at it, right? I'm getting better. This tether is quite outdated. And so we are seeing less and less families qualify for the existing RGAP. And so what that means is when a guardianship is a viable permanency solution and that family wants to continue care and establish a guardianship for that young person in out-of-home care, they run the risk of doing that without ongoing financial support. And the only way then to trigger that financial support would be through adoption, which requires a series of traumatic events for children and families that we'd like to avoid, like the termination of parental rights. And so what we are asking with this policy and funding request is establishment of a state-funded RGAP. So when a guardianship is established and is the right path and the best path to permanency for that young person and their caregivers, that they can establish that guardianship and they have access to those ongoing financial supports to support the stability and long-term needs of that placement of that child. And so that's what this will do. It also makes clear that it is expanded to suitable others as described in current statute, and makes clear that guardianships established by tribal courts of federally recognized tribes located in Washington also are eligible for these RGAP payments. Oh, thank you. I see a heart. Someone loves this package. That's great news. All right, so with that, Renee and I will field a few questions that have come in the chat that we didn't answer. I'm going to start from the bottom and work my way up because this one was relevant to early achievers. Please provide an update on early achievers grading and correlation to subsidy. We'll need to follow up. I am not prepared to speak to early achievers today. It's been a long time since I've been in that world, in the weeds and details. So we'll certainly follow up. I recognize this question came from an anonymous attendee. So we'll get that follow-up posted somewhere and get it sent out when we post the slides. Question about, I think this was related to the housing DP. Was that a housing first model? So I want to be clear about our housing package. DCYF is not going to be a constructor and a builder and a runner of housing. There are brilliant experts across our state who do housing through housing authorities, Commerce, other local entities, other nonprofits, CBOs. Our ask is really about the financial support to maintain case management when needed to maintain federal housing vouchers, as well as having housing specialists and navigators that can exist to connect young people and families who need housing, get housing with those housing experts. Sometimes that may be a housing first model, and sometimes it may be a different model. So I want to be really clear, DCYF is not going to be a housing service provider. Okay, Renee, an SSPS question. The SSPS data overhaul, is that being done in conversation with the Help Me Grow efforts to simplify the system for parents? SSPS is about payment, but I'll let you navigate that one, Renee.
Yeah, I would say so. Our request really is focused on feasibility at this juncture. Definitely, we want to make improvements to the current SSPS system, learn from what the current system, definitely make this replacement system better. So more to come on this. Definitely hear this is a need, and there'll be more stakeholdering to come on that. Definitely hear that concern for consideration, definitely. And then also concrete goods. Does this include orthodontics for youth who don't have Medicaid eligible diagnosis? Again, I've heard this as a concern. This is not the first time. And so as I noted, this really goes back to policy and practice changes that need to be made. So the department has some work internally to be done. And once we've made those modifications to policy and practice, we'll definitely communicate those out, and you'll be informed if this orthodontic is included in that new practice, new policy.
A couple questions about the RGAP bill that I ended on. What about non-relatives being eligible for RGAP? Great question. So that's that suitable other. So suitable others are typically non-relatives, and suitable other, the definition of suitable other is already outlined in that statute that I, of course, can't remember off the top of my head, but is on the slide. And so when it's posted, so yes, non-relatives would be eligible, and they would need to be non-relatives who fall under that suitable other definition as it exists in the statute referenced. Question about BRS rate increases. We do not have a BRS rate increase asked this year. We had one last year and it was funded by the legislature. So we don't have one this year. Renee, there's a question sort of bouncing around here. According to the June, do you see that first question around the economic? Do you want to talk a little bit more about the economic forecast?
Yeah, I think that's a great question, because I see the point where it's the current, it looks like the revenue is increasing when you look at what our total revenue is for the current biennium, what the projection is for next biennium. And I will say that the revenue forecast that came out this week, there was a very slight increase to the current biennium that we're in right now of, I think it was $43 million, so very small. So what when I stated that we're starting to see a decrease, that's in comparison to the previous forecast. So the previous forecast was multiple forecasts have actually, we're seeing a projection of an increase. This is the first forecast that we've seen in a while now, where it's a decrease over the previous forecast. So not in comparison from biennium to biennium, but forecast to forecast. So this is the first forecast where we're starting to see, in comparison to the previous forecast, a decrease of $495 million. For biennium 23-25. So I hope that provides clarity, and so I also noted it's only a 0.7% decrease, but that's just starting. I think that's the beginning of the trajectory that we're starting to see. We're starting to see revenue flatten out. And I'll also note that last session, it was a supplemental year, but all of DCYF's requests, our decision packages, were funded. I'm not expecting that to be the case this year, given that we're starting to see revenue flatten. It's a biennial request, so we have much larger requests this year than we had last year. And then also, as you noted, yes, we don't have the same level of federal resources we've had previously. So all those reasons coupled is why I was really trying to set the stage that I'm not anticipating all of our requests will be funded. I think that's just the reality based on the revenue trajectory that we're starting to see. I hope that answers the question.
Good answer. It's a little complicated.
Yeah.
I think the tension is that the governor has to balance his budget based on what the projected revenue is. So the four-year outlook from the legislature was based on the last revenue forecast, which is now higher than this one. And so that's where some of that decrease becomes accounted for. Background check bill. Will the fee waiver apply to Head Start, home visiting, tribal childcare, et cetera? Katie, great question. I will follow up exactly. I don't want to misspeak. I'm not, so I'll follow up. A loaded question here. What is the backup plan to support all of these great asks if the governor says no? Will some be implemented on a smaller scope? So a couple things about process. If the governor says no, they're not in the governor's budget, and then we really are in a position where we don't actively work on them during the legislative process. We really look at the governor's budget for our guide as a state agency. The legislature still ultimately acts and passes the budget, decides and passes the budget. So there is that intersection there, that potential where the governor may not include something, but the legislature could. If things are not funded in the legislature's budget and the final budget that passes and comes to DCYF, the reality is we cannot implement. Unfortunately, Renee and I and Secretary Hunter don't have pots of gold under our desks, despite the fact I'd like to think I do most days. I don't. And so if elements are not funded or items are not funded, it is likely that we won't and can't implement because we just don't have the resources to do so. So great question. Can you share? Oh yeah, DP decision packages will be linked to our website today with the slide deck or Monday. They are currently available on the OFM website, which I don't have off the top of my head. I'm sorry, Lori, and I don't have it bookmarked or up on my screen to copy and paste in. Do you have a sense of which of these policy areas are priorities for the governor's office? I don't. I wish I had a crystal ball. I know they have a very, very hard job. I don't envy their job. Renee and I's job was hard enough to get our asks to this place. The governor now has all of state agency land, all of the state of Washington, all of the things that he and his teams need to consider. And I certainly don't envy their job and the position that they are in as they have to make some of those choices. With that, It is 11 o'clock. We are right on time and great questions. Folks know how to get a hold of Renee and I. Our emails are on the deck, also available. Mine is at least on the website. Oh, one last question that I will, thanks for the softball, take the opportunity to answer. How can community managers help? Will DCYF communicate the asks via social media so citizens know what we're trying to do? Great question. Yeah, so we will start now sort of communicating out our asks via our website, social media. We'll have one-pagers that outline all of the details of our decision packages available to provide to folks who are interested as technical assistance. And it is, you can choose to do as you wish with that information. Either to your friends, your neighbors, your colleagues, the legislature, the governor's office, etc. So thank you so much for attending and joining us for the hour. It's always an honor to do these. And I think, as I said at the beginning, now Renee and I get to hit the starting line and our teams. So I hope everyone has a great weekend, and please reach out with additional questions.